Hi, my name is Asser, and I am a practicing emergency medicine clinician in Northwestern Pennsylvania. Welcome to The Learning Curve. This is a podcast where we look to celebrate educators in medicine, amplify their fresh voices, and explore the unique niches that make teaching as much an art as it is a science. When I set out to create this podcast, I had a vision. And my vision was to build a platform that not only highlights the expertise of emerging educators, but also inspires innovation in how we learn and teach. In my mind, every educator has a story to tell, a spark that truly ignited their passion, and a method that sets them apart. This podcast is about uncovering those stories. It's about that creativity, resiliency, and curiosity that drive educators to try new things, break old molds, and then leave lasting impact on learners. Whether you're an experienced teacher, a student of education, or just someone fascinated by the learning process, I hope you'll find inspiration and practical ideas in each episode. But before we dive in, let me say this. The Learning Curve isn't just a podcast. It's also a conversation. If something sparks an idea for you or just makes you see education in a totally different light, I'd love to hear about it. So without further ado, let's start the conversation. Welcome to episode 1 of The Learning Curve. Let's start the conversation. We have a really special guest talking about a really unique topic that I think a lot of academic institutions out there have struggles with. How do you engage learners with Journal Club? How do you get them involved? And today I have a special guest, Dr. Dhimitri Nikolla, one of the leading voices in academic emergency medicine research. He is one of the core faculty members as well as the research director at the AHN St. Vincent Emergency Medicine program today, to talk to us about his insights into Journal Club and how he's essentially revamped it for his learners to try to get them to be more engaged with the topic. Dhimitri, thanks for joining us today.
Thank you, and thank you for the very gracious introduction.
I had to hype you up, if only I could do pyro and like fireworks in the background, I think that would have been great. So thanks again for your time. Really appreciate you taking the time out of your busy schedule to talk to us about Journal Club and how we can, as educators, make this more dynamic and involve our learners. So from your standpoint, let's kind of start at the basics and at the foundation of it all. For somebody that, let's say, hasn't been exposed to Journal Club or is pretty far out from residency training and it's been a while where they've experienced it, what exactly is Journal Club?
Well, I don't think anybody really knows the true origins of it, but it probably started at some point in the 1800s in Europe and made its way over to Canada and the United States, and really originated as a mechanism by which physicians could cost share the cost of obtaining journals, which were tremendously expensive to obtain, given that they were hard to produce, and could, in a more social environment, read papers and discuss them and discuss how it affects their patients and how they can implement it in care. And so that's the traditional idea behind Journal Club. It's since migrated a little bit more into more methods-based teaching and critical appraisal since then.
Gotcha. No, perfect. I think that's a really great overview. And from your standpoint in residency training, how do you think Journal Club has traditionally been utilized to try to basically get to our learners?
It really just depends on the program. And how the program uses Journal Club. Some programs use Journal Club the way it has been used in a more traditional sense, like they want to implement some new treatment. Maybe it's a type of nerve block, right? 'Cause those are pretty new to emergency medicine. Most of them got a nerve block. And so they gather some of the evidence on that and turn it into a journal club, and residents and physicians will read it and discuss it in a social environment. And so that's kind of the more traditional approach, and many programs will use journal club in that sense. Whereas other programs will use journal club as the setting with which they provide their research education. So maybe the articles that they select are more dependent on what methods they use and the types of study designs, so that could be integrated as a part of the research education and the critical appraisal education that residents, at least in emergency medicine, are required to have.
From your experience, what's been some of the challenges that you faced with regards to kind of the traditional approach to Journal Club?
I think the biggest challenge has been probably preparation from residents. maybe not necessarily like low attendance. Some residents may be more chronically absentee from journal club than others, but probably more preparation. And I really understand it. I get it. Most residents are not becoming researchers. And while I think it's become more popular in recent years to have an evidence-based approach to medicine and to be interested in what the evidence is behind the treatments and the testing that we do, that's a far reach from being a researcher and really having a deep understanding of the research method. So I really understand why there might be a lot of engagement or difficulty preparing for journal club, because consuming primary literature is hard. And so it probably stems from that difficulty that residents have.
Was that kind of consistent with your experience when you were in residency or even as a medical student, kind of rotating through different sites, experiencing their journal clubs? When you were on the other side of the table, did you have those similar experiences?
Oh, absolutely. I think there's this focus on, when you're a resident or even a student, on like, when you read a paper, what's the meaning? What meaning can you pull from it? And then how does it apply at the bedside? And it's really hard to go through that practice when you don't really have a full understanding of why the researchers did what they did. It very much like in the clinical setting, when you go see a patient, in the emergency department, and they're telling you the story of their complaint, and maybe they went and saw two different doctors prior to coming to the emergency department because their symptoms were getting worse. You, as the physician, experienced emergency physician, you understand the patterns, and you're looking at those patterns, and you're figuring out from the story what's actually happened. And based off your experience, you're like, okay, now I get it. I see why provider number one did this. I understand why provider number two did this. And the fact that this patient has fallen through the cracks tells me that something different is going on and we need to do this, right? Most residents aren't at that point when it comes to research and interpreting research to look at a paper and be like, oh, okay, this is a retrospective chart review, but they use electronic medical record data. Well, how do they validate the data? Okay, it's probably retrospective, so they're probably going to give me odds ratios and risk ratios. And so they will know, okay, an odds ratio is supposed to be interpreted like this, but they may not be able to run through that pattern of understanding, okay, now I see why the researchers did this or that. And that's hard to obtain when your only exposure to research is journal club and maybe presenting a poster in residency. And so, to make a long story short, yes, I had those same challenges when I was a resident. And it's probably even hard for me to go back and remember that, having done a research fellowship and having half my job be clinical research.
I think you brought up a really interesting point about resident engagement, specifically, how do you get buy-in from residents, especially if they don't have that previous exposure? I also think about it, I think one of the other barriers that I've encountered just from my experiences, especially kind of in my later residency years and working with younger learners, is journal club traditionally has that flipped classroom model where you essentially kind of assign, hey man, read these papers and come in. And my expectation is that I will chat about these papers. We'll talk about kind of the methodology and we'll appraise the paper itself. We'll see what are the things that worked, what are the things that didn't work. And then effectively, let's see if this is going to change your clinical practice. And then I think one of the key challenges that I've encountered with working with some learners is, did you actually take the time to read the paper? Did you actually take the time to actually understand and look up the things that you were supposed to look up? So I think that buy-in also ends up being a little bit challenging, but I think that's one of the traditional almost challenges that you have with kind of that flipped classroom model with journal club. Has that been kind of consistent with some of the challenges that you faced when you took over as research director?
Yeah, absolutely. It's hard to do the initial work in a flipped classroom model when you're not necessarily equipped with the tools to do it. It's like, what comes first, the chicken or the egg? You kind of have to be at journal club as a resident for a year and go through our critical appraisal curriculum, which not all programs have a critical appraisal curriculum. We do, to kind of obtain some of those basic skills to then do the reading and understand it before you show up at journal club. So for me, that just means not expecting too much, at least from our interns, with regard to consuming the papers to a degree that they can really understand it. But what it also does for me is it helps me refocus the conversation, because what happens when residents tend to not have the skills to understand what the research is or how the research was done is they kind of revert back to this like, well, how does it apply to my practice? Or, well, this doesn't really mean too much to me in my practice, or I would never do this clinically. And those things are important. The generalizability of the study to your clinical practice is very important. I don't want to downplay that, but it's also like a crutch that sometimes residents will use to critique a paper when they don't necessarily understand the research behind it. So I think avoiding that can actually help promote and encourage residents to like, okay, let's pause and think about the actual research.
I think that's actually a really cool point. And just to kind of segue this, I know you've done some recent changes with Journal Club where you shifted from, hey, one resident read the paper, explain it to the audience in terms of what your thought process is, and you switched to a more resident involvement in terms of having 3 different residents per paper. One resident does the pros, one resident does the cons, and then one of your senior residents dives into the nitty-gritties with talking about the methodology of the paper. What led to that change, and how has that change really affected Journal Club for you?
Well, for me, being a researcher and research director, I wanted Journal Club to be refocused on that research education. That doesn't mean that every resident's going to become a researcher. The curriculum that we go through in Journal Club is a critical appraisal curriculum. It's not what I would use to teach somebody who wants to become a researcher. But we've always had 20 to 30-minute lecture at the start of Journal Club that has been on some critical appraisal topic. And that follows a curriculum that we have over 11 months, because we give 1 month off to the residents in February for their engineering exam. But it follows that curriculum. And so, but I felt like that wasn't enough for a couple of reasons. One, when you only have one resident presenting each paper, that's a lot of work for that resident. And so they either one of two things happens. One, they get overwhelmed, and then they kind of stop talking about the methods and they start reverting to the clinical conversation, and then it turns into a big debate. That's one issue that comes up when you have that structure. And then the other issue I think that comes up when you have that structure is the number of residents who are really tasked with talking during Journal Club is very few. So if you cover 2 to 3 papers, then there's only 2 to 3 residents that are really tasked with having read that paper and talk about it. And so a lot of the other residents may not have read those papers as carefully as they need to have an engaging conversation. And so, yes, we restructured Journal Club to a format where one resident will give a 5-minute talk on the pros of the paper, one resident will give a 5-minute talk on the cons, and then one resident will spend 5 minutes just explaining to the group a particular methods topic that the paper employed. And what that did for us, in my opinion, is one, it guaranteed that at least if we covered 2 papers, at least 6 people probably read the paper. At least you read papers, right? So that's number one. And then number 2, it refocuses the conversation around why is this study good or bad from a methods perspective. As I mentioned earlier, most residents are not going to become researchers. And so this is really their time in residency is the only time they're going to have where they're going to be in an academic environment where they're assessing the quality of research and they're learning the skills to do that. For the rest of their career, they're going to have to learn new stuff, right? They're going to have to learn about new treatments and diagnoses and different ways to care for patients. And so for me, I don't see a whole lot of value in the traditional approach to Journal Club. We're like, oh, we want to implement this new ultrasound guided nerve blocks. We're going to pull a bunch of papers and then talk about it. They're going to be doing that for the rest of their career, or they should be. But for the rest of their career, they're not going to be in an environment where they're learning about critical appraisal. And so that's really what has made it a priority for me, being the lead at Journal Club at our residency program.
That's awesome. So having made those changes, what's been your experience since making those changes? Has there been a particular Journal Club that really stood out to you that you were like, okay, what we're doing now actually works? It makes sense. The residents are buying in, everybody's engaged, and we're actually doing what I set out to do. Was there a particular Journal Club that really, I guess, almost reinvigorated your thought process that, hey, this is actually working?
Yeah. It was probably like the second or third Journal Club after we had changed the structure from just assigning one resident per article to actually assigning jobs, meaning having one resident present the pros of an article, one resident presenting the cons, and then one presenting a methods topic or teaching the group a methods topic that was relevant to the study. Probably the second or third one where I think my senior resident was presenting, and it was very fast and efficient. He was just like, wow, that was easy. And I was like, yeah, well, that's what this is all designed to do, is to make this process of like critical appraisal easier. So instead of like trying to spend 20 minutes presenting an entire article, like you have a structure by which you can review the article and then present it. And then the structure persists in our discussion. So we can talk about the pros and the cons and then the methods. And then I give you a tool to use to assess each article, a critical appraisal checklist. And so that really stood out to me. And I think it stood out to the residents in that they recognized that the structure of this format made Journal Club a lot more pleasant and easier and less painful.
I think the overall feedback must have been positive, where now you're having multiple different learners that are involved with the process. And on top of that, the commitment from them is essentially more reasonable, so that they know specifically, hey, this is the section that I'm going to focus in on. This is my job. This is what I'm going to do. And if I have any issues, I can always reach out to you, specifically even for like methodology, which sometimes can be more complicated. So it's good to have an expert break it down for you and make the material more digestible, so that you can present it to an audience that potentially may also struggle with that same material and content. So that's awesome. Were there any other changes aside from the structure that you guys have implemented with Journal Club that's really helped the learners?
Yeah, well, we gone through different iterations of it. I think I might have mentioned before, I might not have, that we have a curriculum with Journal Club as well. So we follow a year-long curriculum of critical appraisal, which I think is super important, because as you go through and discuss each article, you can refer back to when we had covered that topic in a formal presentation style, and then apply it to the actual literature that we're reading. So I think that's really important. I've been involved in journal clubs that have used other tactics like gamification and Jeopardy, which I think can be a really useful tool when you sporadically like try to change things up and do it. But the example that I'm thinking of, we had a program that did Jeopardy every month for Journal Club, and I could see how that might drag on a lot of residents. And it also doesn't encourage residents to read as much as giving 6 residents like a particular job, like you have 2 articles, three residents per article, one does pro con, and then methods. And so giving at least 6 people read. Because if you do it the other way, then who knows who read.
Yep. If you're doing Jeopardy every month, that might potentially also take away from the actual purpose of Journal Club, which both of us are in agreement is to help these young learners develop these critical appraisal tools. So yeah, absolutely. Great point. So let's kind of step back for a second. Let's say if I'm a young resident or newer medical student, and I come to you and I ask you, hey, why should Journal Club still be a part of medical education going forward? How would you answer that question?
Well, I think the best example of why it should be is probably the pandemic. And I know we're getting to a point where we have some residents who didn't have an opportunity to care for patients during the pandemic. Early pandemic, if you can recall, or some of the listeners can recall, there was a lot of uncertainty as to what is the right thing to do to care for patients. And so a lot of clinicians who weren't used to looking at the primary literature got kind of excited about it and started trying to implement what they read at the bedside. And I just saw countless example after example of clinicians who would read a news article or a preprint about a particular treatment and then, bring it to the bedside, which is not at all how evidence-based medicine should be practiced, right? There should be a structured critical appraisal of each article, which should be at least a decent body of evidence is reflective of the clinical question you're looking at. So several articles, and then it should be summated in a structural way. And then you need to bring that to the bedside and then ask the question, like, does it apply to the patient I'm taking care of? And is the patient agreeable? Do the patient values like align with what this treatment's going to provide? That process that is evidence-based medicine just got thrown out the window. And I think a lot of it was because you had a lot of clinicians who are experts in their field and experts in caring for patients, but we're not experts in critical appraisal and how evidence is generated and how research is done and how it should be brought to the bedside and applied. And so I think it's so important for residents to at least understand how that process works if they're not going to be experts in critical appraisal and in research.
I think those are some great points, especially for, I think, residents that are getting ready to graduate residency in particular, because I think about it from that standpoint with the ever-changing landscape of infectious disease and new research that's going to eventually take center stage. I think Journal Club allows them to have this platform where they can develop these critical appraisal skills that we've been talking about for the last several minutes. And I think giving them those tools to ascertain, okay, like this is a good piece of evidence. This is high quality evidence that I can incorporate into my clinical bedside with my patients to provide the best patient care that I can. And I think that platform, I think it's going to be even more valuable in the coming months as well as the next upcoming years, especially with how things in healthcare are changing. I think something to also consider would be the ACGME changes that are happening in 2027 with regards to research. Is that something that you can also offer any insight on?
Yeah, I definitely can. So scholarly activity and what scholarly activity means for residents may be actually different between specialties, depending on how within what specialty the common program requirements from the ACGME defines it. But in emergency medicine, scholarly activity had a little broader definition. It could include being on a national committee. It could include advocacy work. It could include a lot of different things, quality improvement. We have proposed changes that are upcoming to the common program requirements for emergency medicine that are aiming to narrow that definition down a little bit and aim to have scholarly activity result in a presentation or a publication. And so research is probably going to become, if these changes, a greater part of what the scholarly activity requirement will be for a lot of residents.
That's something where it almost becomes an opportunity for a lot of research directors out there or people involved in research to try to engage these learners, because now it's becoming more and more part of your core curriculum where effectively in order to graduate, you have to have this scholarly activity that's odds are going to be very centered around research. So I think that's going to present an opportunity in its own right to try to engage all these learners. We've covered a lot in the last several minutes. So my question to you is that if I'm a learner and I've listened to this podcast, what are the 3 single biggest key takeaways that I can take back with me?
I think if you're tasked with teaching residents research skills or critical appraisal skills, might be more accurate because not all residents want to do research, but if you're tasked with that, one, having Journal Club is super valuable because it gets residents out of the hospital in a social environment, discussing research and doing scholarly work. Some of my greatest recommendations for that process is to include a critical appraisal curriculum where residents are actually going through maybe a year-long curriculum of the basics of what critical appraisal is and how it's done, so that they're going through that curriculum a few times throughout their residency. And it at least gives them a framework or a roadmap of how that should be done properly. 2, Journal Club should focus on the methods. They have their whole career to look at new treatments and diagnostics and things and decide whether those should be implemented into their practice, but they really only have a few years in an environment with academics and research experts who can guide them through how to properly do critical appraisal. And so Journal Club should really be focused on the methods and what are good methods and what are poor methods and how to interpret those results. And then lastly, I would highly recommend that you give residents specific tasks and tools to complete those tasks. So handing a resident an article and saying, here, present it in 20 minutes is setting them for failure, right? Because they have a hard time as it is reading that article. But giving a resident a task saying, hey, I want you to use this critical appraisal checklist and assess how good the study is. And I want you to present in 5 minutes the pros or the cons. And I think by lowering the bar that way and giving them tools to succeed, you get more out of Journal Club.
Awesome. So just to summarize the 3 key big takeaways from this episode. Number 1, if you're somebody interested in revamping your Journal Club, the first thing would be to try to consider implementing a curriculum where you can talk about critical appraisal the different facets that are involved in critical appraisal and make it a year-long curriculum so that you can essentially reinforce this to your learners every single year. Number two, we really have to focus on the methodology, because once these learners are out of residency, effectively, if they can't understand the methodology as to how research is being performed, they might not be able to ascertain exactly what to take away from this and essentially how the study is conducted. And if it's conducted in a manner that might essentially affect their clinical practice, if they can't interpret all this information and they lack those skills, they're essentially going to stagnate. And the third thing is involving a critical appraisal checklist that can provide a tool that we can give our residents to understand and evaluate how to actually read and interpret a clinical research paper. In lowering that bar, you essentially allow them more engagement and you provide them with a tool that can help them understand what they're actually working with. Dhimitri, was that a reasonable summary? Anything I missed?
I think so. Yeah. I mean, I like the idea of having multiple residents present one article. That way you're ensuring that you have several residents that have definitely read, if participation is an issue at your program. But I think those are the big ones is having a curriculum, focusing on the methods, and giving residents tools to do their job, meaning a critical appraisal tool. I think those are the big ones.
Awesome. And also feed your residents. So don't do it at didactics.
Yeah, super important.
Yeah. If you feed them, they will come. Dhimitri, thank you so much for your time. Really appreciate it. That was a lot of great insight into Journal Club, and I hope listeners can take away information so that they can apply it into their Journal Club and their didactics as well. Dhimitri, any last few words, any social media platform that you want to shout out?
Oh no, I'm not very big on social media, but I really appreciate you having me. I love Journal Club. I love research. It's like my main job, right? And so I love any opportunity to nerd out on these topics.
Thank you so much for your insight, and I'll provide some of the links to what Dhimitri was mentioning during the podcast in the show notes so that folks have access to it. Thank you guys again for tuning in. And if you guys have any other thoughts or comments about what you're doing on Journal Club, let us know. Any kind of information is helpful. Let's keep the conversation going. Thank you guys for tuning in to episode 1 of The Learning Curve.